Hi, everybody. Thanks for joining us today. We look forward to a great discussion with Dr. Lysyshyn and my colleague, Superintendent Kennedy from West Vancouver. My name is Mark Perman. I'm the Superintendent of North Vancouver. And I would like to start today by acknowledging that we are meeting today on the traditional territories of both the Squamish and Tsleil-Waututh nations. And we're very pleased and gratified that we get to learn, educate, live, and share and grow on these traditional territories. Dr. Lysyshyn, I do want to just acknowledge your time today and just say thank you on behalf of Chris and I. We know how extremely busy you are, and we appreciate you just taking the time to share with us and our larger community. Both Chris and I, over the course of the pandemic, have really worked hard to try and keep our communities up to date, our staff and students and families with regular and timely updates with information, and just to really focus on how we can keep our schools open. And that's been through a great partnership with Vancouver Coastal Health and your work and your team. And so we look forward today just to get more information from you as we move forward.
Yeah, absolutely, Mark. Both school districts just wanted to hear directly from the Regional Health Authority, Vancouver Coastal Health. So what we did was we asked families and staff and to send in questions, and we went through those last week and kind of pulled out those themes regarding COVID-19, Omicron, keeping schools and community safe, and so we've pulled a bunch of those together, and we'll test you for the next 45 minutes on a whole range of topics. Probably though, before we go to a question for you, one that came up is actually really from Mark and I first, and that's about a number of questions around like functional closures, which isn't actually a health decision, which is really a school district decision. And so maybe we'll talk about that first and first answer, and then we'll flip to you for the questions after that. Mark, do you want to start off just like what a functional closure is?
Sure. So, I mean, ultimately, a functional closure is that if we don't have enough staff that we can provide a safe learning environment for our kids, and we'll be challenged to provide educational continuity. So really, Chris, what we do every day, I'm probably sure very similar to West Vancouver, is that we're monitoring our staff absentee rates each evening and early morning. And we are watching to see if we're going to have a critical mass of staff that can't actually attend one of our schools. If that's the case, and we can't backfill with appropriate TTOCs, administrators and educational assistants, we then get into that space of taking a look of actually functionally closing the school in terms of in-person learning and shifting it to a hybrid or online model. What I will say from North Vancouver's perspective, we have not actually come close to that scenario at all. We do have enough staff within our system, both obviously our TTOCs and educational assistant substitutes, as well as district staffs, that we've been able to manage through the challenges of some higher absentee rates of staff, but to keep our schools open. So from our perspective, I don't expect, Chris, that we will really probably be needing to go there in the near future. We're starting to see our attendance rates or our absentee rates decline, essentially for our staff illness, which is a nice place to be moving towards.
Yeah, very similar for us too, Mark. And so we're, I know Dr. Henry spoke that workplaces might consider that they might have up to a 30% absentee rate. We've been hovering below 10% each day in terms of our overall absentee rate. And like you, it's actually gotten better. At the end of last week and the start of this week, we've seen a bit of an improvement in our absentee levels. And so at least there's nothing on the horizon right now where we would have to look at a functional closure. Both our student and staff attendance rates have been going up, and so that's really good news and for us. And so, yeah, monitoring it closely. I know it's happening in some other parts of the province, but not something that we're anywhere near considering yet here in West Vancouver.
Yeah, that's great news. So, Dr. Lysyshyn, we're going to start to put you on the hot seat now, if that works. And really, this is more of a broad question for you. But from our community, the question is asked: how has the Omicron variant changed the approach to management of COVID-19 in BC? I thought that'd be a great question to start with, which kind of takes it from this level, and we can funnel it down to more detailed questions from there.
Yeah, the Omicron variant has really changed everything about our pandemic management in BC. It's a variant of the virus that is, first of all, much more transmissible. so it spreads very easily from person to person. It has a shorter incubation period, so once people are exposed, they develop symptoms much more quickly. And the good news, though, is that it is much less likely to cause severe illness, hospitalization, death. And then, it came at a time when the population is also heavily immunized and getting more immunized. The vaccines don't work that well against preventing COVID transmission from Omicron, although they do have some benefit, but they continue to work really well against those serious outcomes. And so that really puts us into a place in our pandemic management where we have managed to prevent most deaths, most serious outcomes. And now we need to focus on that third pandemic goal, which is minimizing societal disruption through the orders and measures that we take. So, the wave hit us very quick because it is so transmissible here in BC, and we saw cases rising very quickly, and that, resulted in changing to the testing guidelines, changes to the case and contact management, isolation guidelines, changes to our ability to do contact tracing and to whether contact tracing makes sense, and then, finally, changes to how we approach things in all the different settings in society. So it's really been a big change. And, it's really what's moving us from sort of a pandemic management of the virus towards an endemic management of the virus, which is much more like how we would normally manage seasonal respiratory viruses, because now the virus has actually become much more similar to a seasonal respiratory virus.
And Dr. Lysyshyn, do you see that what's happening in British Columbia is what's also happened in other jurisdictions that had Omicron prior to us?
Well, we had Omicron pretty early, and so most of the jurisdictions that have had these waves have been struggling in similar ways to be able to keep up with testing, contact tracing, and have had to make big shifts in the way that they are handling the virus, because it's simply not feasible to handle it in the way that we've handled previous variants. So I think everybody is making slightly different decisions at different times, but it's forcing the decision, this decision, to anywhere that's facing Omicron.
There's a lot of conflicting information out there. A number of sources that our families are going to online and social media and sort of those general conversations. We see that in schools, that information about schools in the pandemic, incorrect information. Even major news outlets are reporting. We had around teacher vaccinations just a week ago said that they were mandatory, when that's actually not what came out through the PHO. So, when you get the questions about where people should go for the best information, where do you send people to get the most up-to-date information on this?
Well, I think for most things, the most up-to-date and best information is on the BC CDC website. That has information, about symptoms and testing and isolation, and for most of the questions people have. Obviously, if there's questions like specifically about the public health orders, then the Office of the Provincial Health Officer, they can find the actual orders. Currently, we have very high vaccination rates in the Vancouver Coastal Health region. They're the highest in the province, and we believe that they're also high among school staff. And so, we're not really looking at mandatory vaccination orders for students. Those would come provincially, and then any orders for staff would come from school districts, and that's not something that we're recommending right now. And those recent PHO orders were really about giving health authorities, through medical health officers, the ability to ask for vaccination, records or proof of vaccination if that was felt to be important at a school for managing a COVID outbreak or deciding around vaccination mandates. But this is not something that's really needed in our region, where community vaccination rates are so high.
Dr. Lysyshyn, our principals often get this question, and so we actually pulled it out because we think it'd be great for you just to answer it directly. And that is from a parent. It says, what do you suggest we do about eating times in an elementary school classroom? Students eat snacks and lunch, usually twice a day, at their desks. So how safe is it to have students in a small classroom all take their masks off at the same time and eat at the same time?
So one of the big shifts we have to make as we move, from management of previous waves to the management of Omicron is looking at our strategies and moving away from what we would call risk elimination strategies and working more on risk reduction strategies, because it's not possible to eliminate transmission of Omicron, and the kind of measures that you would take that would eliminate the risk would have to be very severe because this is so transmissible. And so we look to using strategies that reduce the risk. So, the most likely people, or the most likely people that a child is going to get COVID from at school are their friends. And so they are the people that they're going to sit beside at lunch. And whether they eat together with their masks off is not really that important, because they're also playing together outside in close contact, and they may be doing after school activities with those kids too. So, COVID spreads to those who are closest to the case. And, we're not really able to prevent that transmission. And so whether kids take their masks off to eat lunch or not is not really important in terms of controlling transmission. Somebody who takes their mask off on the other side of the room is not spreading COVID to somebody who's far away from them. That's not the way it's transmitted. So, we have to do what's reasonable in schools, and kids need to eat. They need to eat at the same time, and it's safe for them to do that because the people that they sit next are likely the people that they're closest with, and whether they have their mask off for lunch or not is not really that important.
So similarly to what you were saying before, kind of shifting into that space of we have to learn how to live with this in our community and in society.
Yeah, and we have measures in place at the schools to reduce the risk of transmission. There's masks that are worn at certain times. There's separation between how people are seated. There's other measures in place. So these are things that reduce the risk, but we can't eliminate the risk. And particularly when people eat, they need to remove their masks. So and so it's too disruptive to kind of manage that process, and it's just not necessary, because the people that kids are close to, that's where transmission might occur regardless of whether they eat together.
Okay.
So one area where a number of our parents have taken issue with the provincial or public health is around this idea that you're taking droplet precautions are sufficient for limiting the spread of COVID-19, despite what they would see as mounting evidence supporting that it's an airborne mode of transmission, and Omicron is so contagious, it's on par with measles, and so they think that public health might be out of step. How do you respond to that idea?
Well, I think we've always accepted that there is some aerosol transmission of COVID-19, and the places where that is most common are in healthcare settings where aerosol generating medical procedures occur. And so we've always taken precautions to minimize transmission in those high-risk settings where high-risk procedures are causing aerosolization that can result in transmission. So, we've always been aware of this. And so, there is evidence that shows that some degree of aerosolization occurs in the community as well, but this is much less common, and it's not that important when we consider transmission, because we know transmission occurs between close contact between people who are close together face to face for up to 15 minutes. We followed up over 70,000 cases in the Vancouver Coastal Health region, and we know how transmission occurs between people. It's between people who know each other, who are interacting face to face for these periods of time. And so whether that transmission is occurring because of an aerosol that's generated or a droplet, it actually doesn't matter. That's how the most transmission is occurring. And so then we need to take measures to, again, reduce that risk. And, so we have chosen to use masks in the school setting, and that helps reduce the risk. And other measures as well that keep kids apart and things like that. So, we acknowledge there is some aerosolization that occurs, but that doesn't mean that you shift all of your measures to prevent transmission through aerosol, because most of the transmission that we have seen throughout the entire pandemic has still been, that close contact between people, face to face, unprotected by masks, and 15 minutes.
So maybe just building off that last comment in terms of masks, what type of masks then would you recommend students wear?
Well, the best type of masks that students wear are the masks that they have access to, that they can afford, and that they will wear. Those are the best types of masks, and so it's best if they can be well fitting. It's best if they can be multi-layer, but the best mask is the mask that somebody is able to wear. So we're not too fussed about the exact type. Parents will have to make those decisions, and there's some resources online to help them choose. But it's really what is the child comfortable in, and what will they wear, because the kind of incremental benefit of the different types of masks is not what's important. It's sort of the overall measure that most people are wearing masks most of the time that reduces the risk.
Great, thank you.
I'm going to flip to topics and talk about isolation. And again, I think there's been actually a little bit of clarity on this one from the BC CDC in the last week, and Vancouver Coastal Health had a pretty helpful graphic that we've sent out to all of North Shore families just around that. But maybe could you just talk a little bit about current protocols for individuals who are close contacts, and maybe for family members who are asymptomatic? What is it that, if someone in your household has COVID, what is it that everyone else needs to do and isolate, and for how long?
Well, things have really changed with regards to this because of a few things. The first thing is that testing is no longer recommended for most people in the community if they develop COVID symptoms. So most people now will not know if they have COVID. They will develop symptoms, they'll isolate until they feel well enough to go back to work or school, and then they'll go back. And they won't know if they had COVID or not. So that's the majority of people in society now. So we're not actively finding all the cases of COVID. So the cases of COVID that we will find will be amongst some of those high priority testing groups, so people who are unvaccinated or people who are healthcare workers. So we will still be finding cases amongst those groups, because some of those groups can benefit from treatment, and others need to know whether they have COVID or not because of the environments where they work in. And so, that the people who are identified as cases, it will be a very small subset of all the cases. And so just even from a fairness point of view, then it doesn't make sense to handle their contacts differently. But from a contact tracing point of view, Omicron, with its short incubation period, is no longer actually a virus that we can effectively perform contact tracing on. First of all, it's difficult for us to follow up all the cases. By the time a case develops symptoms and is tested, their contacts have already been exposed and often have already developed symptoms. And so there's no actual intervention for us to offer them, because they're already exposed and have developed symptoms if they're going to develop them. So, we've stopped contact tracing, except within high-risk settings like long-term care facilities and things like that. And so because of that, also people are no longer now being directed to isolate by public health. And so we've changed to more of a self-management framework where people who have symptoms or people who are cases are asked to isolate for certain periods of time, but their contacts are no longer asked to isolate. They're asked to monitor themselves for symptoms, and obviously if there's a case in the household, that person is, other members of the household are going to be monitoring themselves carefully, because they'll know they're at risk, but they're not required to isolate unless they develop symptoms themselves. So household contacts are no longer required to isolate, and social contacts no longer required to isolate, and that's regardless of vaccination status.
That kind of gets onto the piece around notifications, which has come up because that's a real shift in our schools, and we no longer are doing those or you're no longer putting out notification letters. So some of our families are concerned about sending their grade 3 or grade 4 child back to school, because without those notification notices, they're worried that they're putting immune compromised family members who might live in the home at greater risk. And so they're not sending their children back to school. What would you say to those families about who are in those kind of scenarios right now?
Well, I think the most important thing for those families is protection through immunization. So the more members of family that are eligible for immunization, that are getting all of their doses and getting their boosters, that is the best thing to protect those family members. But COVID is circulating widely in the community now, and it's there's a risk at school, but there's a risk in every other setting. And in many ways, the risk at school is actually lower because of it being a structured environment where we have these other measures in place. So, families are going to have to learn how to deal with this virus now, how to live with it, just like they have for years with all of the other respiratory viruses that can affect people who are vulnerable as well. So, they were doing this before, they have to continue doing it, really. But, immunization is the best protection.
So Dr. Lysyshyn, kind of segueing with that, because we'll often hear the question, then why not provide rapid tests to elementary students now that the testing location in North Van is being phased out? And why are the tests only being provided to teachers if students can't access them? So is there any thoughts on that, or is there a reason why at this point in time rapid tests really isn't necessary to be coming to schools?
Well, the limiting thing with rapid tests right now is the supply, and the supply of the type of tests that could be done at home and could be distributed to people. So, we're using the rapid tests as a province in the best locations that we can think to use them. And as we get more and more rapid tests, we are distributing them to more and more locations. And so, we have seen some distribution to school staff. Eventually, there'll be distribution to the people attending school, or also to potentially even to the general public. And so there will be some increasing availability of rapid tests, but there's a worldwide shortage of these. Canada's only acquiring a certain amount. BC only has access to certain tests, and so throughout the pandemic, we've had to ration supplies to support the people who are most vulnerable and who need them the most. And so we're continuing to do that, making rapid tests available at long-term care facilities, at shelters, at places where it really helps us with the management. But increasingly, they will be available to people in the school community and even in the general community as supplies increase.
And so just for clarification for our community then, is it the province of British Columbia that acquires the rapid tests, or is it the federal government that acquires the rapid tests and then distributes out to the provinces? Yeah,
well, right now it's the federal government that's getting them, and they get allocated, and they, because they're in such short supply, we can't just go out and buy them ourselves. It's not.
Okay, thank you.
Turning over to vaccination. Several people are wondering around 12 to 17-year-olds. They're getting their doses right now. Is there going to be booster shots for that age group like there have been for the 18+ group?
Well, we'll have to keep following the advice from the National Advisory Committee on Immunization. We've seen that they've just actually this week updated their advice for immunization of children, recommending that children in that 5 to 11 group, saying that they should be vaccinated rather than they may be vaccinated. We've also seen them add a third dose to the primary series for children with moderate to severe immune compromising conditions. So those people get 3 doses as a primary series. But so far, they have not recommended booster doses for that 12 to 17 group or that 5 to 11 group either. People in that group are at much lower risk of severe complications from COVID, and so they likely, although they can still benefit obviously from protection from vaccine, they likely require less vaccine than other groups. But we'll continue to see what the National Committee recommends. They're constantly reviewing evidence on this because it's being generated day by day, and so we may see recommendations change, but currently no booster doses are recommended for youth right now.
Prior to COVID, Dr. Lysyshyn, one of the main reasons that you and I would have interactions was around just vaccination clinics in general for a whole bunch of other things. And I know those were on pause just with all the efforts around COVID. Maybe a couple of pieces to this one. Could you talk about just where we're at with those sort of regular vaccinations that happen in schools, and if those are coming back or are back, and what role that a COVID vaccine might play as being part of that rollout going forward?
Yeah, so those clinics are starting up again, based on our ability to offer them. those are the best way to offer immunization to children. That's what achieves the highest coverage rates and the best protection for the whole school community and the community in general. So, we are trying to get those started again, and they're starting to be booked again. In some schools, we do want to offer the COVID vaccine through those clinics, and it will be offered in the same way that other vaccines are available, where there's a consent process, and then they can be given. But that process is still working through. Still that the main way for people to get vaccinated is through the mass clinics. And the most timely way, because it will take us, of course, a long time to get to every school. But in some schools, we will want to offer it, if we believe that the school community has had some problems being able to access the vaccine.
I do want to emphasize a point there that I think you made. Maybe you can restate it again. Is I think a concern from some families is that their 7-year-old might go to school and get the COVID vaccine against the parents' wishes. Is that something that could happen?
No, not for a child of that age. So for children of that age, there's the consent process where a letter goes out ahead of time, and we obtain consent to give the vaccinations that are required.
Perfect. Thank you.
Thank you. So wanted just to shift to a topic that seemingly is getting more kind of play here, which is long COVID. And so there's research around the world that shows that long COVID can be common and maybe is growing. So does BC and Vancouver Coastal Health specifically have any long COVID clinics? And are there any plans to support, or is long COVID fairly consistent in kids? And what's the data showing out there in terms of the risk for kids when it comes to long COVID?
Yeah, so it's been a little bit difficult to characterize exactly what is meant by long COVID and how much of the symptoms that persist are due to either COVID itself or the severe illness that people might have had when they got COVID and they ended up in the ICU, because people will have similar syndromes after things like that. But I think when it comes to children, what's clear is that children are at lower risk of having persistent symptoms from COVID, and their risk is actually similar to the risk of persistent symptoms following other respiratory infections. So it's not different for COVID for children, so there is some risk that symptoms will continue on a little bit longer. But it's not worse than other respiratory viruses. So, for kids at least, long COVID does not appear to be a major concern. There are long COVID clinics in each of the health authorities where people are referred, particularly after severe illness, from hospitalization, but people can also be referred from the community. And so they're following those patients and getting them the help they need. But, this is largely adults that are accessing these because kids are not really getting a lot of this.
Thank you.
Looking at mental health, and this is a conversation we are having a lot with our school staff, just around student mental health and coming through the pandemic. What are things that Vancouver Coastal Health is seeing with youth mental health, and then what kind of recommendations might you have for families? If they see worrisome behaviors or in their children, what would you recommend that they do?
Right. So, youth mental health was a concern before the pandemic, but these concerns, I would say, have been really accentuated by the pandemic and the measures that we've used to control the pandemic. And that's, really why in this phase, we've got to look at minimizing that kind of societal disruption, because it's a lot of these, orders and measures that we have in place that are exacerbating these youth mental health problems. We're seeing more admissions for mental health problems amongst youth, more physician visits, more concerns like that. So, the best thing that kids can do when they're, kind of developing and in school is, to have, first of all, positive school experiences. And that's something that I know, both of your school districts are trying to achieve for as many students as possible. They have to have positive and trusting relationships with adults in their lives, and those can be adults in the school system or adults in the community. So they have to be able to build those. And the pandemic does put some barriers in place for that happening. If kids aren't going to their piano lessons, if they're not going to their sports practices and games, because sometimes it's that piano teacher or that coach or that other trusted adult that will really end up being a mentor for them, a place that they can, go to for help and help guide them through their life journey. They have to have positive relationships with their peers as well, with their peer group, and so they need time to spend with their friends, and that's also more difficult in the pandemic, where you have smaller social networks and sometimes the opportunities. So we really need to basically kind of remove all of these restrictions so that kids can get back to doing these things that they know how to do, they love doing, and it's these kinds of things that actually helps protect kids, mental and physical health, and helps them, get along with their social and emotional development that helps them so much into adulthood. So, this is really what this next phase of the pandemic is going to be about, getting life more normal for kids so that they can sort their own problems out, because they actually know how to do this.
We've absolutely seen that with sports coming back and more arts programs this year than last year. It's had a hugely positive impact for kids in our schools. Like it is what drives them and gets them excited about coming to school every day. And last year, so many of those things were restricted, and with there being more of those things available this year, it's absolutely, we're seeing that huge difference in kids, particularly kind of in that adolescent 13 to 16, 17-year-old age group, I think.
Yeah, this is the time of life where kids need to find the things they love and do those things with the people they care about, and the more they can do that, the more they flourish.
Yeah, and Chris, I just added that the community-based programs as well. That kids are being able to be back in that if they don't connect at the school level, they have that other opportunity within the community side as well. So I want to just end with a final question. And I'll ask Dr. Lysyshyn first, and then Chris, maybe you can go second, and I'll summarize some final thoughts. But the question comes: what have we learned? So what are the unexpected learnings from the pandemic and approaches to education, or insights that have been gained because of COVID-19? So in other words, what are some of the positives that we can take from this? Dr. Lysyshyn, I'll start with you.
Yeah, well, I think BC has taken a bit of a different approach with regards to schools than many other jurisdictions. We had many fewer, complete school closures than other places, and I think that's been really good for the health of kids. And so that's good, but now we have to continue building on that, and remove the other measures that are still kind of getting in the way of kids finding their passions and connecting with their peers and all these things. So that's what the next phase really is going to be about. We have learned a lot from how we manage schools. We think we made the right decisions to keep kids in school, and now we have to work on kind of improving that school experience for kids, because for them at this stage, the virus is really not different than other respiratory pathogens, and we have to, sort of start managing it that way.
Thank you. Chris?
One thing it's done, it's, I think, changed forever the relationship between health and education. Like the partnership that we have, I don't think is going to go away a year from now. That we share responsibility in the raising of young people in our communities, and that there is a clear interplay between health and education in that. Just with where we were, what we talked about just a couple minutes ago, that priority on well-being and mental health. You're right. It was there pre-pandemic, but it's really shone a light on that, and that's something that we both have some responsibility over. And now I'll just do a couple concrete things around schooling. One is all that push to get us learning outdoors, I think, is something that's going to stay. Especially last year, the idea, get kids outside, the less transmission. And so we still have so many of our classes who've made that part of their normal routine, and they're never going to go back. And the other one is, I think because we haven't been fully out and online, we found a nice way to weave in technology. Kind of, it's more important than it used to be, but it's not like the driver. And so I think we found a nice relationship with the role that technology plays that's going to carry on after pandemic. What about you, Mark?
Well, I think a couple things to build upon that. I think that the value of school in terms of the value of society in general has been really reinforced through this pandemic, and for so many different reasons. Obviously, number one, the social emotional learning of our kids, to provide that stability and that sense of normalcy during this pandemic, but also the importance of the functions of schools within our community as hubs. And how we can support parents during this. And I know that each school district across the province in different ways have supported families who have been in crisis during the pandemic, doing things way beyond our traditional scope. But I also think that, if anything, as we've learned through the last 2 years of the pandemic, and then also some of the other natural disasters that we've had over this year, that we will need to learn and continue to learn how to be resilient as a system, and also be able to modify and adapt depending on the circumstances that come along. So I go back to in all of our emergency procedures, we have a pandemic response plan. Well, that pandemic response plan had probably sat on the shelf for 20 years and never been used. And guess what? It's obviously being pulled out. It's being used heavily. And I think as we move forward, we need to recognize this can happen, and it may happen again in the future. So the learnings from this experience really need to be debriefed at the end of it. What worked well? What can we do a little bit better next time? And so we're not so much in that kind of crisis mode, but really more of that adaptive mode as we push forward. Dr. Lysyshyn, Chris, as always, I know you're all super busy. Really appreciate your time. And Mark, you and along with your colleagues, Dr. Choi and Dr. Dewar, and all those who have been supporting the school districts across Metro Vancouver and Fraser Health as well. We just want to say a big thank you. We know it's been a very challenging 2+ years, and there's lots of angst that gets directed sometimes towards our coastal health colleagues. We know that at the same point in time, our community is very, very appreciative of the work that you do, and supporting Chris and I in leading our school districts and making it the best possible place for our kids to be. So from the North Vancouver School District, before I kick it over to Chris, thank you very much for all of your work, support, time, and guidance during this pandemic.
Yeah, absolutely. Thanks to Mark and to Mark for this morning. Hopefully our community's found some value in what we've been able to share, and we'll continue to do these kinds of things to try to help our community understand the work that we're trying to do in schools, and I think that collective responsibility and that collective goodwill that we have to offer the best possible opportunities for our students in schools going forward. So thanks to both of you, and thanks to everybody who tuned in.
See you later.
Bye.